We'll be talking this topic I have chosen is lift with laser and fistula. I know, but I will be talking about SLOFT. Right. So I think this is misprint. So I'll start my lecture. So there are some hybrid procedures which are being followed for the fistula in nano. There are some are like distal laser and proximal SLOFT (DLPS). One is the distal laser and proximal SLOFT with distal tract coring (DCPS). Distal laser with proximal lift, waft with lift, and wall lift, and distal coring and proximal fistulotomy. So these are very fancy names, and there are different types of procedures. The idea of surgery is the same. The idea is to disconnect the proximal tract from the distal one and to close the proximal tract. And for distal tract, you can do anything. You can do laser, you can do coring, you can do fixation, anything. So I will be talking mainly on SLOFT today. SLOFT with laser. So what is SLOFT? SLOFT is basically it's a modification of lift, which is ligation of intersphincteric tract, and SLOFT is submucosal ligation of fistula tract. So the basic principles are the same. It is a ligation of tract, it is more superficial, it is more proximal, and it leaves behind a smaller stump of the proximal tract. So the approach is antegrade. There are two types of SLOFT also. One is SLOFT, normal SLOFT, which was being done by Dr. D.U. Pathak, and one is the modified SLOFT. So I will be talking about both of them. So what is the SLOFT? With this approach is antegrade. From internal opening, we go to the distal, that only to 2 centimeters. The tract as it emerges from the internal opening is always straight and superficial. So it is easy to grasp the, as I will show you the video, you will understand what I am saying. It is easy to grasp the fistula tract at the starting from the internal part, and it's very straight. Then you can go distally. Its course changes like a river. So the distal course is always unpredictable as regards its curvature and depth. Hence, existing methods are not so easy. So therefore, lift now has many recurrences. So this is the So you can say this diagrammatic representation of SLOFT. So we cut the distal tract and proximal tract at the point of submucosal plane. So these are the only instruments required. No hi-fi any instruments are required. This is a port closure needle. This is a probe, and this is a cannula for putting the dye or H22 inside. So probe is gently introduced to come out. So this is, you can see we have probed the tract here. There is no, I don't have any pointer, so this is the probe. We have probed the tract, and now 2 centimeter proximal distal to the tract from internal opening. We are taking the incision. So first we are blanching the mucocutaneous junction with xylocaine and adrenaline to make it taut, and then we put this xylocaine adrenaline to make it hydrodissection to be done. We give an incision here, and we take the cord, we take the fistula tract inside. We are by the forceps. Here it is very superficial and straight, and in lift when you go intersphincterically, it is difficult to find it out because sometimes it is curved or it's a horseshoe. So it is submucous and it is medial to the internal sphincter, and it's easy to be tied here and disconnected here. So we have hooked the tract, and then tract is disconnected, and we have tied the tract on both the sides. And now this is the disconnection from internal opening. It has been done. So this is at the distal tract. You can do anything. You can pour out. I am telling about the laser. You can laser the tract, or third thing, you can do a fixation of the tract. So this was basic concept of SLOFT. Another is the modified SLOFT. This is the diagram showing modified SLOFT. In modified SLOFT, the difference is you are finding the internal opening. After internal opening, you put you put a probe, and on the probe you take sutures inside the anal canal. You are not cutting submucosally. You put the sutures over the probe, behind the probe, one suture, and figure of 8 again in front of the probe, and you tie. After tying the internal opening inside the cavity, then you disconnect the tract at the submucosal plane. So it is much more. It is easier than SLOFT, normal SLOFT. So basically, we do hydrogen peroxide is injected from the external opening in bubbles. So I will show you the video only. I have told you both the techniques, so I will directly go into the video. Opening approximately 1 p.m. and also patient is having grade 3 piles. So we are this is the method of palpation of the tract. So because by this manual palpation, you can find where is the tract going and what is the course of the tract. So it is the examination of fistula tract. So now we are probing. I am explaining something, but they don't have any sound.
नहीं sound नहीं.
So we have probed it. Now we are putting H2O2, hydrogen peroxide mixed with methylene blue and saline to find the internal opening. So you can see the bubbles inside the internal opening. You can see, appreciate the internal opening. You can see the bubbles inside. Can you see? This is the internal opening. So now as we have identified the internal opening, our next step is to probe the fistula. We have probed the fistula. Now we have removed the probe. We are cleaning the tract. We are debriding the tract completely. After that, we have put up the probe again, and now at 2 cm submucosally we will elevate it by using xylogane, and then we will submucosally cut it here. It is a normal sloft which we are using, which is the original sloft we are doing. We will cut it here submucosally. Then, by the use of port closure needle, we will tie both the ends of the tract and cut the fistula tract and disconnect it. So, and I am using this special needle, which is 5x7, 5x8 needle, which this is 20 Vical 5x8 needle. So I am using this. This is more curved, so it is very easy to take the knot. So this is the port closure needle I am using, and I am taking the tract. So we are tying the tract now. So I have tied the tract and disconnected the tract as a slot. Now this is the distal tract. I can do laser. Here I have done the coring also. You can do coring, fixation or laser. Anything you can do. Now I will be doing the laser part. As internal opening is closed, we will do the laser now. So the laser is done basically 1470 watt machine is used. We use 10 millimeter per second. If the fistula is around 4 centimeter, then 400 joule energy has to be given, right? So there is some light music to freshen up. So the laser is going with the music. So finally, so this is the final picture. You can see there is nothing, everything is closed. This is the only small thing left. Right. So this was normal sloft, and I will be just showing you a small video of modified sloft also. Just few minutes. So this is a modification of sloft. In this you can see we are probing the tract, and we are railroading the laser fiber inside. First we have given the laser after debridement and all. Now we will be doing the modified sloft or submucosal ligation slot. In this we are not cutting submucosally, we are putting the probe and we are directly taking the bite in front and in back of the probe in the manner of figure of 8. So we have just closed the internal opening inside the anal canal. Now we are making the breach at 2 cm mucosally. We are just separating the proximal tract with the distal tract, and we can confirm it by putting a probe. So now it is confirmed. This is the distal part which has come inside, and the proximal tract has been closed. So here I am not using laser. We can do laser. We can do anything. This is a new device which is called fixation device. It's a fixation device. I have put this to show you. So it goes inside and it is rotated in a screw-like manner, and the whole the fistula tract, which is the distal, comes out like this whole thing. So this is fixation. We can do laser also, and you can do coring also, whatever you like. But I do generally fixation or I do laser. So these are the minimal access techniques. The results are very good, and I have found earlier I was doing lift with the laser. Now I am doing only sloft or modified sloft with laser, and my results are very good. Thank you.